Let's get reaction now from a very experienced medical professional, chairman and medical director of DoctorCall, and a medic himself, Dr. Charles Levinson. Good morning, sir. Welcome to Morning Glory.
Morning, Mark.
Is this strike today justified?
Mark, no, this strike is completely tone deaf. And as I think one of your callers alluded to, we're just coming into peak flu season. We've actually got a flu epidemic expected in the next few weeks. And fortunately, this year, companies have taken it upon themselves to vaccinate record numbers of staff privately. We know because we're the largest provider of independent flu vaccinations, and that should be taking the pressure off the NHS over the next few weeks. But it's completely shot down by the damage done by the strike, which is far, far greater.
And do you think patients will be harmed as a result of this industrial action?
Well, they sadly always are. And I think there's obviously steps taken to prevent immediate harm, but the NHS attempts to improve the NHS are set back, scheduled operations are set back and so on. So of course they are. I think the really important point, which actually refers back to what your doctor you spoke to earlier said, is that you become a doctor to help people. And in exchange, doctors have expected and enjoyed public gratitude and social standing. And that is one of the reasons young people go into medicine. And the strikes have completely squandered or what is remaining of that goodwill. And that is doing long-term damage to the profession.
The junior doctors, resident doctors, as they're known now, Dr. Levinson, do work very hard. They work long hours. Do they need a bit more love from their employers?
So I think it's not about money in the end. It's that it is very difficult working in a dysfunctional system where you just can't do your job properly. And I think that is what the challenge is. And but the problem is these strikes set back attempts to put things right.
And Charles, you are the chairman and medical director of DoctorCall. Many people will be turning to the private sector because the NHS, all too often, whether it's A&E, GP appointments or access to a consultant, are just finding that those services are not available via the NHS.
So private providers like DoctorCall should be there to complement the NHS and provide the nice-to-have bits that that the NHS can't or won't provide. But here we are picking up the pieces, and people should pay for extras. They should not pay for essentials.
And what are your thoughts on the British Medical Association? Because it seems that the majority of doctors, when polled, as reported by The Times today, don't support these strikes. So has this union gone AWOL?
I mean, I'm afraid I think you're right. I think it is out of touch. Absolutely, it is.
Listen, Charles, it's brilliant to speak to you. You spoke a lot of common sense during the pandemic when you pushed back on some of the measures which have led to a waiting list of over 7 million people. Really enjoyed your company again today. Dr. Charles Levinson is the chairman and medical director of DoctorCall.